of the time, or in what we consider the average range, or what's called the average range, most of the time. For whatever reason, there are these human individual differences. And it would be wonderful if schools and society and families were set up so that we could rearrange everything to meet those individual differences in needs, in learning needs, in the way the kids need to be treated. I can tell you, as a single parent, I was trying desperately not to mess up my kids, and of course therapists had said, as a single mother, you're going to have screwed up kids, you know, because there's no adult male in the house, no matter what you do. So I was already afraid, already worried. But you know, when Jeremy was going to be late for school and he couldn't make a choice between milk and orange juice, it took me a long time to realize he really doesn't care. It's just because of his attentional style and going together with my assumption that he does care. It was a wrong assumption. Realized he doesn't care. I'll just give him one or the other. But it took me a long time to realize that, because our society is not set up, and much of the mental health system is not set up to coach people on these sorts of things. So a lot of parenting, of course, is trial and error. That's what a lot of therapy is as well. And I think it's really important for us as therapists and as parents to acknowledge that that's what we're doing, that this is not science we're dealing with for the most part here in the realm of mental health. It's really more like art. So if we look at the range of things that could cause somebody to be distractible in a similar way, a parallel to the range of things that could cause somebody to have trouble learning an academic subject, we come back to many of the same kinds of conditions. It could be motivational. I'm distractible, I'm bored, I just don't care about anything enough to pay attention to it very long. It could be, if I'm a child, that something is happening at home that is upsetting me so much, or that's happening in school that's upsetting me so much that it makes me distractible. I just can't concentrate. It could be something I ate. It could be something in the chemicals in the school or the teacher's perfume. People don't like to think about these because the social consequences of trying to make changes in these arenas are so overwhelming. And so it's much easier to think about, let's just give a pill. Let's assign a diagnosis and give a pill. And then, because this pill is supposed to do the job, let's not monitor what's going on very carefully. Just renew the prescription as needed. So there's a range of causes of distractibility, all the way from what I believe in some cases, certainly nothing like the number of cases that the APA would have you believe, or that individual practitioners who are diagnosing kids right and left as having attention deficits and putting them on Ritalin and putting them on other psychotropic drugs would have you believe. But I think in a small number of cases there is a neurological basis, and in other cases it's any one of that range of other causes or some combination of these, making it very hard to figure out. That doesn't mean we mustn't keep trying to do it, but it means we have to be aware of the complexity, and we have to be aware that we live in a culture in which it's very easy to blame everything on the mother, for example. She's always a good scapegoat, a safe target, and you can believe that she's probably blaming herself. When I was the supervisor of a clinic at the University of Toronto, in which usually the kids who were brought there, they were brought there because they were having some sort of school problem, whether it was learning to read or do math, or whether it was distractibility. I said to my students, let me make a suggestion. I said, usually by the time these kids are brought to our clinic, they have been seen by a large number of professionals. And I said, usually they're brought by their mothers, sometimes by their fathers or both parents. And usually if they get here, it's because the parents are really deeply concerned about what's going to be helpful to their child. And a parent, just like, I'm a psychologist, I'm not a car mechanic. I am at the mercy of whomever I choose to fix my car. I assume they know what they're talking about when they say, you need a new oil pan, or the whole transmission has to go. I shouldn't have to become an expert on everything about how cars work. But parents are in the same kind of position because they go to somebody who says, I'm an expert on children's learning problems. I'm an expert on reading disability. I'm an expert on distractibility or on ADD. And they're really at their mercy. So parents often mean well. And I said to my students, if there's any reason to believe that this parent or these parents are trying and have been trying to get good help for their children, I urge you to say that to them. Just say the sentence, it's clear that you are really trying very hard to get help for your child. Well, next week we met again as a class, and the students said, we can't say that anymore. And I said, why not? And they said, everybody starts crying when we say that. I said, yeah, all the more reason to keep saying it. Why do you think they're crying? Oh, we don't know, we don't know. And these were new students, and so they were not aware of how much parent blaming goes on and how much parents are not spoken to with respect by mental health professionals. I think all parents who have a child who has any kind of problem should have explained to them the range of things that could be causing the problem. Parents can often then say, oh, you know, my kid drinks milk all the time, and I've noticed that right after a meal, their mood changes, or they can't seem to do their homework right after a meal. I have to wait a couple of hours and then suggest, because parents can often educate us if we sort of lay out the territory for them and say, let's look at these various kinds of factors. Now, ideally, no kind of treatment, whether the treatment is love your child more, or whether the treatment is, I want to try this drug. Ideally, no kind of thing that a professional, especially those of us who call ourselves helping professionals, recommends should ever be done without at least these following criteria being met, these two criteria, and they almost never are, sadly. One is every pro and con you can think of related to this treatment should be explained. You should not assume in the patronizing way that some therapists are trained to do, well, if I tell them that these bad things might happen, then they'll imagine they're all happening. We have to have more respect for our patients than that. The other is we have to make sure that these people understand the whole range of possible things that we might try. Whether it's prayer, writing poetry, a consciousness-raising group, changing diet, changing chemical exposures, family therapy, whatever. We need to make sure they understand the entire range. I would never want to deny any treatment across the board to anybody, any more than if somebody had a serious physical illness, I would want to say, well, you can't try this. I want them to be fully informed and then decide, hopefully with some support and assistance from me, about what they think it's worth trying. But the range is not usually put out there for the people who come to us for help. Not everybody has a Peter Bregan. Not everybody has the option to homeschool their kids if you think what's wrong is the teacher. People on welfare, people who are single parents, people who need jobs, which is an increasingly large proportion of the population, don't always have the options available to them that we wish they might. Children can be distractible, children can fail to read, children and adults can have a variety of problems that get labeled mental health problems, mental disorders, when the causes are the way they're treated by a racist, sexist, homophobic, ageist, ableist, lookist society. And as therapists, we are often overwhelmed. People that I supervise doing therapy are often overwhelmed by the prospect of how can we change the society that this child lives in or that this adult lives in. I can't make sure this person is never going to be sexually harassed. I cannot undo the damage that racist treatment does. And so often what therapists do is instead